Hello, everyone. I'm Dr. Marty Ross, and tonight is another Conversations with Marty Ross MD. This is going to be our last webinar for the month of June. And so I'll be joining you again after the July 4th holiday. So in case I don't get a chance to say it later, everyone have a good July 4th. We've rescheduled tonight's webinar from tomorrow, when usually Thursdays I have webinars, but I'm going to be sitting in a hotel in San Diego tomorrow at a medical conference, and so I wasn't going to be able to be here with you. But I hope I learned some good things that I can bring back here for everyone as well too. So the way that these webinars work, for those of you that are new, is there's two main ways you can participate. Number one, you can listen to the questions that I read, because they're going to be questions that are presented by people here participating tonight, and see what the answers are that I give to those. The other way to participate is to actually write a question to me. And the way to do that is on the bottom of your, on the right-hand side of the computer, down at the bottom, is a chat box, and you can write your question to me through that chat box. When you write the question to me, just be aware that every time you hit the enter key, it sends a separate question to me. So try to write a long, continuous question, and know that I'll be able to figure out what's going on with that. You don't have to hit the enter key until it's done, okay? So if you are new, welcome here. And I do see a number of familiar names showing up here again from previous webinars, and I'm glad to see you're back and that you're getting some benefit out of this as well too. We've had a lower sign up than usual because it's Wednesday and compared to the normal Thursday. And so it may be that you're all going to be able to get a number of questions in, and we may even not go the whole hour and a half if we don't have enough questions. So I just want to let you know, I'm anticipating this may be a shorter webinar tonight just because it is not on the usual night. Okay. All right. So we'll see how that goes. I mean, I may eventually tell you, write more questions if you have more questions. So for instance, I can already tell you, we have a minimal number of questions. And so if you haven't written something and you want to know, feel free to write questions to me. Okay. All right. So one last thing, I am doing a recording of tonight's webinar. Tomorrow morning, you'll get an email from me announcing that recording is ready for you to see. My anticipation for tomorrow is that we'll have that done somewhere between 8 and 8:30 in the morning, because I start seeing patients here at 8:30 a.m. in the morning. So I'm going to want to have that done before I start the day seeing patients in my clinic in the morning. All right. And so without any further ado, let's go ahead and get started here. Hello, Jim. Well, say hi, Dr. Ross. I'm sure that all of us in this webinar would agree that you are greatly appreciated. Well, thanks. I appreciate that. I appreciate you guys too. Let's see. You've mentioned recently that you are using both diflucan and Japanese knotweed more often lately in treating Lyme and co-infections. You detailed last week how you are using diflucan. How are you using knotweed exactly? For Bart, how does its effectiveness compare with Sida acuta and Houtennia? Also, are there any other antimicrobials that are you starting to use more now than you did in the past? That's a good question. So historically, in my practice, when it came to treating Lyme, I was using cat's claw and also atovabark because of some compelling research from about 12 years ago now that showed that both of those used together were quite effective at killing growing Lyme spirochetes and growing cyst form of Lyme. Okay, so that's why historically we have used those. The other thing I more recently added in about a year and a half ago, 2 years ago now, was the use of cinnamon clove and oregano oil, liposomal cinnamon clove and oregano, because there's compelling evidence from Johns Hopkins University that they can treat persisting or hibernating type Lyme. And so I've been using it for that, and also using it because it treats hibernating and Bartonella as well too. Now, the cinnamon clove oregano is a herb that I use a lot of. In fact, I pretty much use it in most of my treatments now, whether they're prescriptions or based treatments, or they are herbal antibiotic based treatments, because the liposomal cinnamon clove oregano treats growing Lyme and treats persister Lyme, has the ability to remove some biofilms too. And then for Bartonella, it also treats growing Bartonella and persister Bartonella as well too. Okay, so that's one that I'm using in practically most of my treatments, actually. Historically, for Bartonella, I have used Sida acuta and Houttenia. And so in terms of what I historically have used, it's cat's claw, Atova, Sida acuta, and Houttenia. All right. What's changed is the research that's been being conducted looking at what do you use for persisters. So everyone, so let me just make sure we're all on the same page here. So in both Lyme and Bartonella, we now know that at least in laboratory experiments, that some of the germs move into hibernating forms of the germs, or we call those persisters. And persisters basically go into hibernation, slow their metabolism way down, and ignore the standard antibiotics we throw at them. And so a current thinking in the world of Lyme is one of the reasons that people have a hard time getting over Lyme or get into relapse issues with Lyme is that we've developed this pool of persisters from when they've been on antibiotics or herbal antibiotics, and that these persisters go back into growing forms and wreak havoc in the body eventually. So many of us are trying to do things to treat persisters at the same time that we wind up treating growing forms of the germ. Okay, so what some of that research has shown us then, and this is research over the last year, we now know from research over the last year that Japanese knotweed is very useful against persister Lyme and persister Bartonella and can help with growing forms of those. We know that Cryptolepis, which we historically have used more to treat Babesia because it's an antimalarial, is also effective, at least in the lab, at treating growing and persister Lyme and growing and persister Bartonella. And then finally, we also know that, actually, those are the two ones. Those are the two. Okay, now newer research also tells us that cat's claw, regular cat's claw, is actually good against Lyme persisters too. Okay, so what am I using more in my practice now than I have historically? Well, Japanese knotweed, Cryptolepis, and practically in everybody's treatment, they're on liposomal cinnamon clove oregano. Okay, how do I use Japanese knotweed? I'm going to use it as part of either my Lyme or my Bartonella treatments. One of the ways I'm doing it, for instance, is to use cat's claw and Japanese knotweed for growing Lyme and persister Lyme, and then Houttenia and Japanese knotweed to treat Bartonella. Okay, that might be one way that I wind up doing it. I am also using Cryptolepis. If I've got somebody that we've tried the cat's claw and the Otova, or I've tried a Sida acuta Houttenia, and we're just not getting anywhere, I might consider doing a Cryptolepis and Japanese knotweed option to help treat them too. Okay. I sometimes will add, if I've got somebody that has difficulty doing the liposomal cinnamon clove oregano and is not able to tolerate a knotweed, I might then use Cryptolepis as my main agent to treat persister Bart and persister Lyme. Okay. So what am I seeing in my practice though? I'm seeing that knotweed is pretty effective. I'm also seeing crypto is pretty effective too. The reason I don't go to crypto first instead of knotweed though is that it's a taste issue. Crypto is really foul tasting stuff. Many of you know that. And so I think that the Japanese knotweed is a little bit more palatable. The other advantage of Japanese knotweed is it's actually anti-cytokine too. It helps lower inflammation chemicals called cytokines. Okay. All right. Now, having said all that, I just want to talk about terms here real quick. So everyone, the Lyme germ has two or three different ways that it exists. It can live as a spirochete. It can live as a microscopic cyst. And then it can move inside of cells. And inside of the cells, it takes on something called an Lform. Okay. Now, the spirochete and cyst can be growing or it can be persisting. Okay. So you can have persister spirochetes and growing spirochetes, and you can have persister cyst and growing cyst. Regarding the Lform, we don't know from any research whether it actually goes into a persister state inside of your cells or not. Okay. In terms of Bartonella, there aren't different forms of Bartonella. There is just the Bartonella germ can either be growing or it can be persisting. Okay. All right. I hope that gives you some insights there, Jim. And thanks for your question. Hello, Josh. Let's see. Hi, Dr. Ross. What would be the causes of chronic fatigue after Lyme and Bartonella treatment? I have been on the ATP, glutathione, and CoQ10 for a month, but still have bad fatigue, which can get debilitating if I do any exercise. Also, if I have any carbs or sugar, brain fog, and a depression feeling comes on, which makes me very tired, can't perform any day-to-day activities. Any advice on how to investigate causes further and or potential solutions to try? My doctor has tested my thyroid and general blood markers, including sed rate, CRP, which are all in normal ranges. Okay. All right. So causes of fatigue can be persisting, ongoing Lyme and Bartonella infection. All right. So now you've said you've treated. I would need to ask you a lot more questions to see, is everything gone? Is it just fatigue that you have? Okay. But you still have to consider, could they be a problem? Okay. Another problem that can lead to ongoing fatigue, even after you've gotten rid of Lyme and Bartonella, is too many yeast growing in the intestines. And how that occurs is once you've been on antibiotics, you're a setup to get too many yeast in your intestines. Even if you put tons of probiotics in and you've used nystatin through your treatment and you use periodic diflucan, you are still a setup to get too many yeast. And if you get too many yeast in your intestines, they trigger the immune system to make cytokines, and cytokines will fatigue you. All right. Things that make me wonder about yeast in you, intestinal yeast, is that you get when you have carbs and sugar, you get brain fog and depression. Okay, so as you feed yeast, you feel worse. Okay. So I'll show you an article you can look at to help you determine if you do have too many yeast, but too many yeast can be a cause, okay? Another cause of ongoing fatigue can be if you're one of the 25% of people that can't remove mold toxins from your body. And from just having been exposed to mold toxins that's hanging out in walls and buildings that you've been at, you may not even been aware they're there, but 25% of us can't get rid of mold toxins when we absorb them. And those mold toxins can trigger excess cytokines as well too. All right. The testing you would do for that is to do a urine mycotoxin test to see if you pee out too many mold toxins. The lab I like to use for that is a lab called Real-Time Labs. Okay. All right. And then the other major cause of ongoing fatigue can be mitochondrial injury. I know that you are doing the ATP, either 360 or ATP fuel, glutathione, and CoQ10. ATP fuel and ATP 360, everyone, are supplements that help repair the covering of your mitochondria that can get injured when you have chronic infection. Mitochondria are your energy factories. If the covering gets injured, then these cell energy factories cannot generate enough energy and you'll stay fatigued all the time. What helps it is to do phospholipid membrane repair. Both ATP fuel or ATP 360 can do that. Those are products by Research Nutritionals. The newer product is the ATP 360, and I think it does a better job, to be honest with you. That's 3 pills 1 time a day. Glutathione and CoQ10 can also help with that mitochondrial repair. Now, when you're doing mitochondrial repair, Josh, you have to keep in mind that it takes about 2 months to maximize or to start to see benefits sometimes. So you've only been doing the repair work for about a month. You may need to give it more time. But in addition, from what you wrote here, I have to question if too many yeast is present there too. Okay. All right. So those are some things for you to think about. Okay. I'm going to do a screen share and point out some articles to take a look at. Okay, so this is my Lyme information site, Treat Lyme by Marty Ross MD. All right. And in terms of trying to figure out if you have a mold toxin issue, take a look at my detoxification section here, and then look at this article I wrote about mold toxin illness. Okay. In terms of trying to figure out, do you have too many yeast, take a look at my yeast section here and take a look at this article called A Silent Problem. Is it yeast? There's a questionnaire you can actually fill out in here that will give you some useful information about whether it is too many yeast that might be bothering you as well too, okay? And for those of you that need more information about mitochondria dysfunction and energy and what you do about that, take a look at my energy and fatigue section here. And then take a look at how to fix mitochondria and get energy in Lyme disease. To give you a lot of information about what to do, okay? All right. All right, let's see here. Let me get back here. There we are. Okay. Good luck to you, Josh. Thanks for the question. Hello, Mary. Let's see. Is it possible for some to have BBB? I think you mean Borrelia, which is Lyme, Bartonella, and Babesia for over 20 years, or did it have something to do with treatment not being aggressive enough? So I'm not sure what you mean by the last part of your question. I would need to know what you mean, what treatment you had to say whether it was aggressive enough. But it is possible that people can have Bartonella or Borrelia or Babesia for more than 20 years and probably and even do well until for some reason their immune system can't keep those germs under control anymore. And then they start having problems with the illness. All right. So you can have infection in you that your immune system is keeping under control and you don't have disease. Okay. Dis-ease. That means you feel bad. Okay. Because our immune systems can take care of things. They can keep things under control. But if you happen to have like a major life stressful event, stress is one of the number one suppressors of the immune system. Suddenly the immune system's ability to keep those germs under control may go away. And then you start manifesting the symptoms of those infections, in which case we call that disease, and it will start showing up. So yeah, it's possible. It's very possible. The other thing is if you did not have a long enough course of antibiotics initially, it may have been enough to knock the germ load down, but not enough, and where your immune system can keep it under control, but not enough to get rid of the infections, and then you can still have problems too. Okay. Thanks for your question. Hello, Leslie. Are you familiar with Desbio treatment for Lyme and Babesia? If so, what are your thoughts on that? So I don't use them in my practice. What I do know is that they are homeopathic treatments, meaning they're energetic medicine. Basically, anything that is a homeopathic uses basically takes substances that should cause problems, and then we dilute them so much that only that's left is the energetic imprint of those substances, and then they're supposed to help with killing. Generally, I'm not impressed with those means of actually getting over Lyme and co-infections. And I would say the same thing about Desbio. From people that I know that have come into my practice that have tried it, I'm not aware of really that many beneficial effects from it. Okay. Good luck to you. Hello, Flickerine. Let's see. My brain is so fried, I can't even think of questions. Well, hopefully other people do. All right. Thanks for your observation there, Flickerine. Hello, Dave. Let's see. Do you see any benefits from adding fish oil to your recommended supplements? Any benefits from using this? Thanks. So yeah, I mean, fish oil. So if I've got somebody that is having a lot of inflammation, we've got them on glutathione, we've got them on curcumin, which, as many of you know, those are two of the biggest things I do to manage inflammation, decrease cytokine inflammation. Curcumin as a product made by Thorne called Rifa 500. 1 to 2 pills 3 times a day, and try Fortify Orange or try Fortify Watermelon liposomal glutathione by Research Nutritionals, done as 1 teaspoon once or twice a day. If I'm doing both of those and somebody is still really inflamed, sometimes it is beneficial to add in fish oil. And fish oil can also be anti-inflammatory. Okay, fish oil, yeah. So I might add it more as another agent to help. I tend to think of it as giving a low bang for the buck, meaning it doesn't give you the biggest benefits, but it can be something that can be added in that sometimes gives some benefit. Okay, all right. Good luck to you, Dave. Thanks for our question. Hello, Robert. Let's see, Dr. Ross. Does the Lform damage the cell it's inside of, and does it invoke an immune system response? Thanks for the great webinars. It's a good question. We think it does. I haven't seen any science that proves that it does elicit the immune reaction. In fact, what's interesting about these Lforms is the infectious disease doctors, the IDSA and all those guys and ladies, they deny there even is something called intracellular Lyme. And so even that idea that you can have this living inside your cells is controversial. As we know, everything in Lyme seems to be controversial. So the science around Lforms is a very small, Lform Lyme is a very small body of science, most of it just showing that you can have Lforms. But I haven't seen science around it. I mean, it doesn't exist. I just haven't seen anything that says whether you get damage to the inside of the cells or does it invoke a strong immune response. We think it does. We think it is another reason you get all these excess cytokines, but I haven't seen science that proves that, to be honest with you. Okay? All right. Thanks for our question. Can it damage the inside of the cells? It may. Again, we just don't have a lot of science around that, okay? The reason I talk about Lforms is I want to make sure that I get rid of them so that these Lforms don't pop back out of the cells and cause injury outside of the cells too, okay? Hello, Dave. Let's see, how long can you safely use glutathione and curcumin for? Any risk for long-term use? Some of my patients I'll use for a year, 2 years, even longer. I don't see any risk of long-term use of either one of those. Okay. All right. Hello, Mary. Let's see. Hi, Dr. Ross. Can Mepron be effective at a lower dose than you recommended? So everyone, Mepron is also known as atovaquone. It is an anti-malarial medicine that we use to treat Babesia. Right? And doses that we tend to use are, so it comes as 750 milligrams of atovaquone per 5 milliliters or per teaspoon. So most of us use a dose of one of those twice a day, or a teaspoon twice a day. Sometimes you find more benefit actually going higher, up to 2 teaspoons twice a day. The difficulty if you go higher is it can tend to lead to diarrhea and upset stomach. Now you can decrease the chances of getting diarrhea and upset stomach by taking it with some fat at the same time. The fat that you take it with leads to better absorption of it. Sources of fat can be like having some avocado, having it with flax oil or olive oil, like even a teaspoonful of those. Nuts or nut butters you can have it with. That can sometimes help too. Okay. Now, can it be effective at a lower dose? The answer is yes, but much less likely. And it all depends on the person. There are some people that I rarely will use it at low doses, at like 1/2 of a teaspoon twice a day. But I tend to find less success in those people that I use it with. And often we'll try to work towards something stronger if we can. Okay. All right. Thanks for that question. All right, let's see here. Hold on here, everyone, just a minute. Hold on, everybody. I got to respond to something here real quick. All right. All right. Let's see here. Hello, Flickerine. Let's see. My son has bad brain fog, and we have tried neurofeedback and neurophysio to try to help him with this with no success, especially with the neurofeedback. He would get strong migraines, light sensitivity, throbbing, getting worse with movement. Would untreated, unresolved infections make it impossible to work on the brain training these modalities to work with? Neurofeedback and neurophysio could help, but if you have unresolved infection or you have something unresolved that's irritating the brain, whether it is mold-toxic issues, whether it is Bartonella infection, whether it is Lyme infection, then yeah, it's going to make it harder for things like neurofeedback or neurophysio to work. Okay, yeah. Thanks for the question. All right, let's see here. Hello, Margaret Lee. Let's see. Is there a maximum Rifabutin dose that needs to be reached to cure Bartonella? 2231. Currently taking with azithromycin and herbals, can people heal on smaller doses? So Rifabutin, everyone, is an antibiotic that is in the same family as rifampin. And I tend to use them interchangeably. I know the times that I'll tend to use Rifabutin more than rifampin is if I've got people on a lot of psychiatric medicines. Rifabutin tends to not have the same degree of interaction with them that rifampin does. Now, I know my colleague, Dr. Mozignani, who treats a lot of Bartonella, thinks and says publicly he thinks Rifabutin is more effective. I'll be honest with you, I haven't seen that. I think they both have equal chances of helping a person, to be honest with you. For Rifabutin, it comes as a 150 milligram pill. For rifampin, it comes as a 300 milligram pill. For Rifabutin, a top dose that I will wind up using in a day is 600 milligrams. For rifampin, a top dose that I would consider using would be 1,200 milligrams. Generally, though, most of my treatments with Rifabutin are using 150 milligrams twice a day. I sometimes will use 300 milligrams twice a day. And there is an occasion, if that's not working well enough, I might go to 450 milligrams in the morning and 150 milligrams at night. I believe that's a Mozignani idea to do it that way too. I'll do something comparable with rifampin. I'll do 2 300 milligram pills or 600 milligrams twice a day. Sometimes I'll go 900 milligrams in the morning and 300 milligrams at night. Okay. But yeah, they either one of these can be effective. Lower doses can be effective. You don't have to do high doses to get well with those. By low dose Rifabutin, I mean 1 pill twice a day. By low dose rifampin, I mean 300 milligrams twice a day. Okay. Yeah, there you go. All right. So it's all very individual. And keep in mind, you don't always have to go to the highest dose to get well. Yes, there are probably some people that have had great benefit when they bumped up the dose. My experience is majority of people probably do quite well on the lower doses with the rifampin and the Rifabutin. And again, by lower dose Rifabutin, I mean 150 milligrams twice a day. And by lower dose rifampin, I mean 300 milligrams twice a day. Okay? All right. Thanks for the question. Hello, Caroline. Let's see. Hi, Marty. Caroline here from down under Australia. Hello, down under. Let's see. I have a patient. Oh yeah, I remember. I remember you from last time. See, I have a patient that is doing really well on herbs alone. She is taking Japanese knotweed, cat's claw, danshen, sita akuta, and some other supportive herbs. My question is, she still hurts us slightly more of an off feeling. Will she still do well if she pulses these herbs so she doesn't have that off feeling? Thanks again for being so generous with your time. So pulsing, everyone, and Caroline, thanks for that question. Pulsing, everyone, means using the herbs for antibiotics, whether they're herbal or prescription antibiotics, for periods of time and then stopping them and then resuming. Okay. So for instance, one way that I will pulse some antibiotics is to do 4 days on and take 3 days off. Some people might do 5 days on, 5 days off. There's no exact way to do it. Okay. The idea behind pulsing is that, and where we started doing a lot of pulsing is with the Lyme germ in particular, Borrelia, the Lyme germ. We know that because there were experiments done at a Northeastern University in Boston, I think about 6 years ago now, where they first discovered that Lyme has persisters. Okay. And I talked about persisters earlier tonight. And what they did in those experiments at Northeastern University is they showed that if you used antibiotics continuously, that it would cause the germs to go into persister, into hibernation. And then if you stopped the antibiotics, you could wake the germs back up into growth state. And if you did this starting and stopping 4 times, you could wipe out all the germs. All right. So everyone was thinking, oh my God, that's the way we're going to basically pulse everyone and we'll be done treating everybody's Lyme and it'll never bother them again. The reality is some people for their Borrelia Lyme respond to pulsing. My experience is the majority of people do not. It's not as simple as starting and stopping antibiotics. Okay. But for Lyme, I do think it's okay to try. For Borrelia, it is okay to try pulsing. And the reason it's okay with Lyme is Lyme also replicates extremely slow. It's by some estimates every 4 weeks to every 8 weeks. So during the period you're not on the antibiotics, the germ is not rapidly coming back. Okay. By comparison, I am not a big believer in pulsing for Babesia or pulsing for Bartonella. And the reason I don't believe in doing that is both of those infections replicate rapidly. So for instance, Bartonella is shown to replicate every 24 hours. So on those 3 days you're off, you're growing your Bartonella right back again. All right. So, and I've had some of my patients that have seen other colleagues of mine here in the country that do pulse for Bartonella and do pulse for Babesia, and were not getting well. And the minute we put them on continuous treatments, they did get well. That's not to say that for some reason, some people may do better pulsing for their Bartonella Babesia. Obviously, some of my colleagues do it that way. But my experience has been you've got a greater chance with Bartonella and Babesia to use continuous rather than pulsing of your herbal or prescription antibiotics. Okay. All right. So anyhow, I think that answers your question. I hope that gives you some insights on that. All right. Good luck to you. Hello, Laura. Let's see. Thank you for the time and insight. You are greatly appreciated. Thanks. Let's see. I tested positive for IgM for Bartonellaquintana through Vibrant Lab blood test. A short time later, I did the microbiology diagnostics Marcon's nasal swab test. The nasal swab test showed positive for staph coagulase negative, moderate amount, and E. coli large amount. Can you please discuss the connection between Bartonellaquintana and E. coli? How does one go about treating Bartonellaquintana and E. coli? So I'm not sure I would treat for the E. coli. I'll just start by saying that. So the nasal swab that you had done, and its intention is to find an infection called methicillin-resistant coagulase negative staph. that's known as Marcons. And the reason we test for Marcons is based on a theory of a specialist named Richie Shoemaker, who's the doctor that first discovered that there's such a thing as Voltoxin illness. And in Shoemaker's theory of things is if you clear mold toxins, you treat them, you bind them, and somebody still remains ill, then there have to be other things that have set the immune system on so that it stays chronically inflamed, okay? Or he calls that chronic inflammatory response syndrome. All right, so in CIRS, chronic inflammatory response syndrome, the first thing you do is look to see if there's mold toxicity. If there is, remove it. And if you still remain sick, then in Shoemaker's ideas, you then look for another cause. His other cause that he thinks is that some people have methicillin-resistant, coagulase-negative staph in the nose, and that is what perpetually inflames the immune system. And if it's there, you should try to get rid of it. His theory has nothing to do with treating E. coli if you find it there, or treating a staph coagulase negative that's not Marcons negative. His theory doesn't say what to do for those. It's only that you treat for methicillin-resistant coagulase negative staph. Okay. Now, I will tell you, I've used his theory, and I find no benefit in removing Marcons. In addition, I find no benefit in keeping it gone. It always comes back. And there's a number of us that have an observation. I know Dr. Neil Nathan in his writings on mold toxicity and his writings on treating and following some of Shoemaker's work, he doesn't believe in doing Marcons treatment anymore either, okay? Finding E. coli in the nose may have nothing to do with your illness. It just may be a coincidental finding, all right? So to answer your question, I don't think I wouldn't even bother doing anything with that E. coli. And then in terms of treating Bartonellaquintana, the ways that you treat for Bartonellaquintana are the same ways that you treat for Bartonella henselae or any strains of Bartonella. So I can show you my article I've written about what do you use to kill Bartonella, but anything that you would use to address the any strain of Bartonella will treat any strain of Bartonella, basically. Okay, all right. The other thing I would be careful about is my experience working with Vibrant is that they are not always accurate when they find Bartonella and Babesia infections. They've done a good job validating their Lyme testing technology. They've done some extensive studies on that, and I think their way of testing for Lyme has been validated. But I question the validity of their test results when it comes to Bartonella and Babesia. In my practice, I still rely on, for Bartonella testing, I do the IGeneX immunoblot test for Bartonella. I think it's the better test that's out there. Okay. All right. Good luck to you. Thanks for that question. Oh, let me do a screen share here for you too. All right. So let's take a look at my section called Infection Treatment Plans. And regarding how do you approach Bartonella, take a look at my article here called Kills Bartonella, where I lay out a number of treatment options that you can do. Okay, so for instance, down here, I list a number of ways that you can treat Bartonella. There's a lot of ways, okay? And you can do it with prescriptions. And then down here, I describe how to do it herbally as well, too, okay? Thanks for your question, Laura. Hello, Charles. Hello, Dr. Ross. I've been having an increase in leg cramps from time to time during my Lyme and mold treatment, especially after GI detox capsule and at night. Usually take Welchol for 4 days and GI detox on the 5th day. Wonder if it's an electrolyte issue or an increase in toxin issue. I take magnesium 1,400 milligrams a day. Should I go back to taking a combo electrolyte product? Anything else I could do? So the way that I approach a situation like this in my patients is if you're getting nighttime leg cramps, I do like to use magnesium. You're already doing that, and you're taking a pretty hefty dose of it. The other thing I like to make sure is that I've got a person on good levels of anti-cytokine, anti-inflammation herbs. So that would be to do a curcumin. I like using the Thorn Mariva 500 product, and that would be a 500 milligram pill, 1 pill 3 times a day, or 2 pills 3 times a day. And you might even consider adding in some glutathione, liposomal glutathione, a teaspoon a day. The other thing you might want to do is see if your provider would help do blood testing to see what's going on with potassium levels in your blood. What are your electrolytes like before starting to supplement those further than the magnesium? Okay. All right. Good luck to you, Charles. Hello, Galiasi. Do you use Effecto labs to determine what spirochetes is active? So Effecto Lab is a lab here in the States, Effecto Lab Americas, that does ELISpot testing to see if you have Lyme, Bartonella, Babesia, and maybe I think they do viruses too. But what an ELISpot test is it looks to see do your white blood cells that are called T white blood cells, have they actually seen Lyme in you, or Bartonella in you, or Babesia in you? All right. Keep in mind that the majority of T cells in our body live for 2 months. Those are the active T cells. There's also a group of T cells called memory T cells that could be positive if they remember having seen Bartonella, and they live more, or Borrelia, they live more than 2 months. Okay. All right. So what Effecto Lab does when they're doing their Lyme test, they're only looking to see if you have T cell reaction against Borrelia burgdorferi. Their test does not look to see if you have activity against the other kinds of Borrelia, like Borrelia afzelii, Borrelia guerini. It's possible you may have some cross reaction. That the way that they test for this, there may be some cross reaction between all these germs, and therefore their test might pick up a guerini and pick up afzelii, but they don't specifically test for afzelii or guerini or any of the other strains except for Borrelia. So therefore, they might miss it. Okay. In terms of their Bartonella, they're only looking to see if you have T cell activity against Bartonella henselae. And we recognize actually that there are 15 kinds of Bartonella that might infect a person. And so therefore they're missing potentially 14 kinds. Okay. I believe their Babesia is only looking if you have T cell activity against Babesia decani. I'm sorry, microti. I may be wrong on that, okay? But the issue with Effecto Lab is that they're not looking broadly enough. They may be missing a number of strains and the reactivity of T cells to those strains, all right? So for instance, the predominant strain of Lyme in this country has been Borrelia burgdorferi, all right? But especially out on the East Coast and up into the Maritimes, up in Canada, for instance, the predominant strains are starting to be the European strains that have worked their way across the water. And those are Borrelia afzelii and Borrelia guerini. Those are becoming quite predominant out there. And so Effecto Lab may not be an effective way of testing out on the coast, basically. Okay. All right. Thanks for that question. Hello, Charles. Let's see. The glutathione markers on my Great Plains lab oat test was normal. Would I still benefit from taking oral glutathione? I would not rely on the Great Plains organic acid test as indicating everything that's going on in your body. Unfortunately, the Great Plains organic acid test have not been validated to actually reflect what is truly going on in a person. All right. So I wouldn't necessarily rely on that as my means of deciding whether I should be on a glutathione or not. Okay. So what I mean when I say validated is when these independent labs come up with a way of testing for something, they're supposed to go out and find, they're supposed to take their test and test it against samples that are known to have the chemicals and samples that are known not to have the chemicals. And then they're supposed to find out how accurate are they picking it up. And I'm not aware they've done the validations. I may be wrong. I'm just not aware that they've done the validation studies on that. Okay. All right. Hello, Chris. Is parasite cleaning required to fully treat Lyme? I have heard that if you don't remove the parasites, they can invest you with Lyme. So, how can I say this? The idea of parasites getting impairing your ability to get over Lyme and being the ongoing problem that keeps you from getting well on Lyme for most people is a fad idea. I'm going to be quite blunt about it. It's an idea that it was perpetuated by Dietrich Klinghardt out here. Dr. Klinghardt is a medical doctor that works a lot with integrative medicine, and he has claimed that he thinks it's the predominant thing that keeps people sick. Majority of us that treat Lyme do not believe in his theory. And I will tell you, I get the majority of my people well without ever doing anything that deals with parasites, and they stay well. Okay. So I don't think he has found scientific foundation behind his idea. And I don't think that parasites is the predominant problem for people. Okay. All right. So there you go. Thanks, Chris. This idea about parasites was big about a year ago. I started seeing all kinds of questions about it, and somehow it had gotten out. So I used to see a lot of questions. But again, I think back then it was more of a fad idea, and I still think it is. Okay. Hello, Joe. If we are planning on getting pregnant after handling Lyme, is there an herb combo we can take to prevent a relapse during pregnancy and later while nursing? If so, what would be the dosing if there is such an herb combo? So the problem is none of the herbs that you could use for Lyme have been studied in pregnancy. We don't know if they're safe, and I wouldn't recommend them for that reason. We just don't know. Okay. So sorry about that. Good luck to you, Joe. Hello, Jen. Let's see. What are your thoughts on cryptolepis? I've seen some studies that show it was highly effective against Lyme by Babesia. Is there a reason you don't recommend it as an initial herbal antibiotic? So again, I reviewed crypto tonight earlier, and that we got some lab experiments now out of Johns Hopkins University that show that crypto is good against Babesia. Well, we've known that historically, but more recently, the Hopkins studies say that it can treat growing and persister Lyme, and that it can treat growing and persister Bartonella. The problem is the dose that I find effective requires that you go through almost 11 ounces of the stuff a month, and therefore it's expensive. So the reason I don't use it as my upfront treatments is the expense of it and also the foul taste of it. It's one of the stronger, more foul tasting herbs, basically. But I mean, you could, but just be ready. You're quite an expense, and you're going to have to deal with the taste of it all. Okay. Thanks for the question, Jen. Hello, Margaret Lee. Let's see. Is there a minimum amount of time patients need to be on prescription antibiotics, antimalarials, etc., to treat BART, Babesia, and Lyme? My doctor's daughter is considering stopping after 5 months or so, and I'm worried that is not long enough. She will take herbals after for maintenance. Does that seem too short to you? Of course, to stop, she must be asymptomatic clinically. Don't want to relapse because she stopped treatments too soon. Thank you for your generosity by sharing your knowledge to us all. Okay. So we talk about different germs and the different timelines that I see. Okay. So first of all, Babesia, most of us are going to treat Babesia for a minimum of 4 to 5 months. And that is the time period that we find to give the less chance of relapses. That corresponds to the lifespan of a red blood cell. And keep in mind, Babesia lives in red blood cells. Red blood cells will live, once they're made in the bone marrow, for about 90 to 120 days. And the idea, I think, is that when we're using these anti-malaria herbs or prescriptions to kill Babesia, they are killing some of the germs in your living red blood cells. But the other thing that they do is they coat the new red blood cells that are being made in the bone marrow to keep them from ever getting infected. And so we find a better chance if we go through one life cycle of red blood cells. So that winds up being at least 4 months. And most of us treat for at least 5 months to make sure that we just keep it out of the new red blood cells as they're being made. Okay. All right. Bartonella, many of us find 4 to 6 months is a minimum amount of time you're going to need to clear Bartonella. Ultimately, with both of those infections, you want to make sure their symptoms are gone before you stop. Okay. Lyme, on the other hand, if somebody's got chronic Lyme, an average length of time to recover can be 1 to 2 years. And by Lyme, I mean the Borrelia infection. Okay. It takes longer. My general rule of thumb is regarding the Lyme, Borrelia, is that I treat until I can get somebody symptom-free for 2 months, and then I stop, or I treat until I can't make any differences for the person for at least 4 months. In other words, we plateaued for 4 months, okay? Keep in mind, when I say treat, that can involve using herbal antibiotics instead of prescription approaches too, because I think in many situations they can be used interchangeably. But I would not stop everything. If you have a chance to get somebody completely well, that's my goal. But again, if you can't get completely well, be at a good plateau for at least 4 months. And no matter what you do, if you can't make any differences, then it may be time to consider stopping. Okay. All right. Good luck. Good luck with your daughter. Hello, Bob. See, I noticed in an article you mentioned how your practice was under review by the medical board. Do you mind if I ask the background of that story? Do you feel that the LLMDs are at risk for acknowledging chronic Lyme and not following CDC guidelines? So I actually was under quite an extensive evaluation by my medical board, resulting in me stopping practice for a year. And I've been back in clinical practice now for about 2.5 years. But before that, I was out of practice. Not that they made me stop. It's just that with the scrutiny that I was under, I found myself starting to do things with my patients that were more meant to please the board instead of doing what I thought was the best thing for my patients. And so it was starting to impair my decision-making ability. The reason I got in trouble with my medical board is that how I first got in trouble with them is that I had a patient that had chronic mold toxicity issues, that had unrelenting pain, that had been seen prior to seeing me by a pain medicine doctor that ran her through every type of narcotic imaginable. Nothing helped. And they discovered by accident that the sleep medicine called Ambien actually helped her pain. And there's a reason for that. Ambien interacts or binds to a receptor in the brain called the GABA benzodiazepine receptor. That is the same receptor that things like gabapentin, which is Neurontin, anti-seizure medicines that we use to regulate chronic pain, they bind to that same receptor too. And when you use something like an anti-seizure medicine for pain, the top doses can be unlimited that you use, because you use an amount that gets the pain out without actually impairing a person, okay? So for instance, gabapentin comes as a 300 milligram pill, and we can use gabapentin all the way up to 7,200 milligrams a day if we need to, all right? So with this person, we wound up using higher and higher amounts of Ambien, as had been recommended by her pain doctor. I got reported by a pharmacist for using that, and that brought the medical board in to look at my practice. And then they discovered I managed Lyme disease and that I used alternative medicines, and we were off to the races. And so it became complicated. So what I was really in trouble for was using Ambien, which I understand why they gave me some scrutiny on that. But in my opinion, they should have turned around when I explained why and showed them the science, the limited science that said it's possible, and realized that I was following through on what a pain management doctor had started her on. But they didn't. They persisted. And yes, I was in trouble because I was treating chronic Lyme, and my medical board had on it an infectious disease specialist who was against treating chronic Lyme. And then they were just had a lot of difficulty understanding functional and integrative medicine because they were all prescription type doctors. And so it wound up becoming a protracted review of my practice. It eventually culminated in a random review of 20 of my most complicated patients. And eventually they walked away. They decided that they couldn't find anything wrong beyond their concerns over my use of Ambien. And they other than having basically making claims that I had difficulty in my practice and asking me to do some things, write papers and go to a medical records course. Once I completed that and they completed their random audit of the 20 patients, they let me alone. So I never lost my license, but I did have a very difficult evaluation with them. So in terms of all of us that treat these disorders, it's difficult because we risk medical board action if we get reported, and it doesn't have to be from our patients. It can be from family members, it can be from pharmacists, it can be from insurance companies. And so all of us that treat these illnesses, regardless of what our approach is, risk our medical license to treat you, okay? But many of us do it because it's the right thing to do. It's right to help people, all right? So, but I survived, and I'm back here doing what I do. And I've been able, that year I took off, I was able to keep my Lyme education site going, and was able to stay involved that way too. And I'm glad I took the year off. I didn't want to keep practicing medicine under the scrutiny of my board and not make the best decisions for my patients. Okay. All right. So thanks for that question, Bob. Hello, Ellis. Let's see. Hi, Dr. Ross. Thank you for doing this Q&A every week. You're welcome. My Bartonella and CMV is flaring again. I wake up at least 3 times to urinate every night. Mornings are the toughest to wake up. Any suggestions for me? So first of all, I don't know about the CMV flaring. What I would say is bladder symptoms and urinary frequency, urinary burning can be related to Bartonella infection. So I can understand why you're saying maybe your Bartonella is flaring. I'm not aware of CMV being related to that, okay? But the one thing you ought to do before saying that this is Bartonella is talk to your providers and see if somebody do a urine test to make sure this just isn't a garden variety E. coli bladder infection, okay? So we have to be careful when we have Lyme disease and related infections that we don't always say that everything is due to Lyme and related infections, okay? In terms of things you can do to calm your agitated bladder, I like, in addition to treating for your Bartonella if it's active again, would be to do some things to help protect the irritated lining of the bladder that can happen from Bartonella. So Bartonella can lead to something called interstitial cystitis of the bladder, which means inflammation of the bladder lining. And so what you want to do, what I like using is 2 herbs. One is called glucosamine and the other one is quercetin. Quercetin is an herb that can lower histamines, but it also lowers inflammatory cytokines and does quite well at doing that in the bladder lining. Okay, the glucosamine is useful because in the bladder, the glucosamine is broken down and turned into a microscopic gelatinous coat that covers the lining of the bladder to keep your urine from irritating, the acidic nature of the urine from irritating the lining of the bladder. You can either do it as glucosamine sulfate, 500 milligrams 3 times a day, and quercetin as a 250 milligram pill, and you would do 2 of those 3 times a day. Or there is a product made by a company called Botanica that is called Bladder Ease IC, and it has in it glucosamine, quercetin, and some arginine in it as well too. And if you do that, it's 4 pills 3 times a day. Okay, all right. I'll show you that product here in a minute so you can see it. And then, consider with your providers whether you have enough symptoms beyond bladder irritation to suggest whether Bartonella is active. If you do, then you might want to take a look at doing something about that, the infection part of that as well too. Okay, so let me do a quick screen share here for you. All right, so in terms of what I just said about your bladder, take a look at my article, the section I have here called Bladder. And this is where I describe what interstitial cystitis is and what you can do about it, okay, in terms of at least dealing with the symptoms, okay? And then in terms of the product that I like using, again, this is my supplement store, so anyone can buy from here. And so if you're looking for sources of some of the herbs I mentioned tonight, feel free to, okay? But in terms of this formula called Bladder Ease, well, actually, I just type bladder in there. So the product, this is it. This is Bladder Ease by Botanica. And again, this has both the quercetin and the glucosamine in it, okay? The other option would be just to go with straight glucosamine. And this glucosamine I'm talking about is actually the glucosamine that some people do to rebuild the cartilage in their knees, for instance, okay? So this is my Thorn glucosamine product. And then for the quercetin, it is also a Thorn product called quercetin phytosome, okay? So those are some ideas for you to think about, all right? All right. All right. So for those of you that are interested, again, in my supplement store, keep in mind, if you do buy from us, we ship for free as long as your orders are over $50. And I cover any taxes. I don't have you pay taxes. I pay the taxing authorities on your behalf, okay? The reason I ship for free and the reason that I cover your taxes is I'm trying to see what we can do to make these products as least costly as possible. I know many of these are expensive. These products, the reason I don't sell them for lower than what I do is each of the manufacturers has pricing restrictions. And the lowest prices I sell my products for are what the lowest prices are they allow. So the only other way that I can help you is to cover your shipping and to cover your taxes. Okay? All right. Good luck to you, Elise. Hello, Joe. Let's see. Is there a common thread or reason on people you see who are highly disabled through Lyme and its co-infections? I know of people who are almost completely incapacitated through chronic Lyme. Do you think there is a correlation between these people and failed antibiotics or misapplied antibiotics? So, Joe, it's very individual. Some people, it's that they were probably not put on the best combinations to begin with. Some people, they were put on good combinations and they didn't work. There are about 15% of people that we treat with Lyme and co-infections we can't help, and we don't know why. That's the big $1 million question. That's where a lot of the research is being done. So, pouring tons of antibiotics into people helps a lot of people. But there's about 15%, maybe even 20% of people that we can pour all the antimicrobials in you we want, and we're just not going to make headway. And we don't know why. There are no common threads that describe the people that will get better and the ones that don't get better. I have no, after doing this for nearly 20 years, I guess coming up on 18 years now, I have no common threads that I have been able to find in my practice. Okay. All right. Good luck to you, Joe. Hello, Edward. Let's see. Hi, Dr. Ross. I'm a post-Lyme and toxic mold patient with common variable immune deficiency disorder. For the past 5 months, I've been struggling with COVID long haul, and one of my symptoms is burning, painful joints. You had recommended I increase the liposomal curcumin, glutathione, and quercetin. Now take 2,000 milligrams twice a day of curcumin, 500 milligrams twice a day of quercetin, and 400 milligrams of glutathione 1 or 2 times a day. However, if I miss even one dose, my joint pain escalates and will even wake me up at night. I am wondering if these supplements are only keeping the cytokines at bay rather than actually decreasing them more permanently. Is there anything else you would add? I'm awaiting a report from Dr. Patterson, which he analyzes a panel of 14 cytokines. My experience with long haul COVID is more debilitating than when I actually had COVID. Thank you so much for your assistance. So, I'm glad you're looking at Patterson's work. I'm still not so sure whether it is valid or not valid. I know he's got a theory that says that there's a certain pattern of types of cytokines, a fingerprint, if you will, that says it is related to COVID, long haul COVID. There's a certain cytokine pattern that would show that. He also has some science showing that there's a certain cytokine pattern that would suggest that your Lyme was a problem. I don't know that he believes in chronic Lyme triggering those cytokines. Okay. But I think we're still learning to see if his work is valid work or not. Okay. To be honest with you. I would follow through with him. I know that if he sees the cytokine fingerprint, that he would put people on some of the statin medications to help. There are people that report some benefit from that. Other things that you might consider adding in actually could be acupuncture might make a difference for you. That's going at this a completely different way. It's working energetically and working on your pain receptors, etc. But I have had people in my practice that get benefit from using acupuncture to turn around situations like this as well, too. Okay. All right. Good luck to you, Edward. Hello, Laura. Let's see. What are your thoughts on the Amen clinics and SPECT scans to effectively identify, treat Lyme and Bartonella? So the Amen clinics are a group of clinics that focus on neurologic manifestations of illness and neurologic illness, and they work with integrative treatment approaches. One of the tests that they do is a test called a SPECT scan, which is a way of looking for at the brain and determining areas that have either low or mostly low blood flow, okay? And there are certain blood flow patterns that can suggest Lyme and or Bartonella infections. And so they're using it as a means of seeing with those infections, do you have brain manifestations of it? Is it diagnostic of Lyme and Bartonella? No. But there is a pattern you will see in people with Lyme and in people with Bartonella that sometimes shows up on SPECT scans showing that they have brain involvement manifesting as blood flow issues in the brain. Okay? All right. Thanks for that question. Hello, Chris. If someone was symptom-free after healing from Lyme but tested for high mold, would you still treat the mold if they are doing well physically? I would want to know more what you mean by high mold, first of all, but actually it's probably not going to change. There's different ways you can approach mold. If you mean that they did a urine test and they had high levels of mold toxins, but they're not symptomatic, keep in mind the accuracy of any test we do, or any test we do, can be wrong. Okay, you can have false positives. And the predictive value of a test to show that you have the illness you're testing for increases with the number of symptoms you have of that illness, okay? So one question I would raise is, although you're testing positive, is, do you really have the illness, or is it a false positive test? Okay, that's one question I would raise. The other question, though, the other thing I would do is, even let's say it is real, you have no symptoms, you really do have mold toxins in you, I wouldn't treat. Your body is in balance. Your immune system is dealing with it. I see no reason to do things for this problem if you're not having physical manifestations of it. Okay? All right. Thanks for that question, Chris. Hello, Dave. Let's see. Are you still recommending the COVID booster? Also, do you think we should take Paxlovid? Not sure if Lyme patients are considered immune compromised or high risk. So I think, in my opinion, I'm going to give you my opinion here. I think that when people test positive for COVID, regardless of whether they're high or low risk, I think that they should be put on Paxlovid within a day or two of getting that, because it is shown to shorten the duration. That's my opinion on this, okay? All right. In terms of recommending the COVID booster, boy, I'm kind of in between on it, because I even have to consider whether I'm going to get it too. I've had two of my series, and I've had one booster. I know I qualify for a second booster, and I also know that the reason to get the booster is that there's a lot of COVID out there. Okay, all right. What I am choosing to do at this point with my own safety is, when I am flying, I wear an N95 mask still. If I am in crowded situations like at arenas or concerts, basketball games where I'm inside, I'm wearing an N95 mask. I am waiting at this point to see if I'm going to get the booster or not. And what's keeping me from getting it is I'm also wanting to see, is there going to be enough of a shift in the months ahead in the type of COVID that's out there to warrant that maybe they should come up with a whole new vaccine altogether. Okay. That's what I'm doing in my approach for myself. Okay. Now, for my patients with Lyme, I am looking basically at how they handled the first rounds of vaccines and the severity of their immune compromise that they might have. If they tend to be very immune compromised and they handled the vaccine relatively well, I might have them do it. So I'm not sold yet on the recommendation to get a booster, the second booster. I don't see enough compelling information about it. And my considerations, at least for myself, is this whole thing going to shift and we're going to eventually just need a whole new vaccine? So I may just wait on that. But with that in mind, I'm doing extra precautions. I'm doing N95 mask still at this time. For instance, I suspect at my medical conference down in San Diego tomorrow, I may be one of the lone people in a room full of physicians sitting there with the N95 mask on, and I'll do it because I will take precautions to protect myself from getting it again. I've had it one time, and I'll take those precautions to prevent it. Okay? All right. Thanks for that question, Dave. Hi, Josh. Let's see. How do you determine what is Lyme or Candida versus chronic ongoing inflammation that is caused by immune dysfunction? And how do you fix this issue? There's not a simple response. I'm always looking to see, is Candida there? And I just get a sense of it. So if somebody's got a lot of sugar cravings, intestinal gasiness, bloating, poor digestion problems, I'm probably going to treat them for intestinal yeast and see if that makes a difference. Okay. Now, if I've done my clinical screening and I don't find anything that says candida, then I'm going to try to see, is there anything that suggests active Lyme? So, and yes, you do raise the question of immune dysfunction. And I'll be honest with you, it's more of a clinical hunch that I have based upon a detailed clinical history as to what's going on. So I don't have a single pat answer for you on this one, okay? But in everyone, I'm trying to automatically consider, is there yeast? And I make that determination based on clinical symptoms, okay? I showed you earlier the article that I've written about how do you diagnose yeast, and I'd take a look at that, okay? All right, thanks for the question. Hello, Flickerine. While taking yeast killers, is it beneficial to take cytokine-lowering supplements? Is the liposomal glutathione better than taking NAC? So generally, when I'm having people kill germs, including yeast, that may lead to Herxheimer reactions, at a minimum, I'd like them on curcumin, 500 milligrams 3 times a day, or quercetin, 500 milligrams 3 times a day. I tend to use quercetin in situations where there's excess cytokines and increased histamines. But both quercetin can lower cytokines and curcumin can too, okay? Glutathione is another option that helps, but it works in a different way than the curcumin and quercetin do. Curcumin and quercetin get inside white blood cells and interrupt the factory production line, if you will, of cytokines. What glutathione does is a strong antioxidant, and from the outside of the white blood cells, it blocks oxidizing agents that tell the white blood cells to make cytokines. So it interrupts the ordering process, if you will, okay? It interrupts the order reaching the factory to make cytokines. In terms of what do I think is stronger, I think liposomal glutathione is stronger than NAC, N-acetylcysteine NAC. NAC is a building block for glutathione that still relies upon your cells being able to manufacture glutathione. And sometimes that process is really impaired when you have chronic Lyme or chronic debilitating illnesses of any kind. And so therefore, I prefer doing just the oral glutathione directly. Okay. All right. Thanks for that question, Flickerine. Hello, Flickerine again. Let's see. Thanks so much for these fantastic webinars. It's appreciated. Thank you. Appreciate that. And here's another one from Flickerine. Let's see. Can yeast and other infections damage the intestines, or is it just that the overgrowth produces cytokines and toxins that cause functional issues? So it's a good question. My sense from working in my practice is not that you get into permanent injury, but rather you get it's the issue of the cytokines and toxins leading to functional issues, as you suggest. Okay, all right. Thanks for that. Hello, Carrie. Let's see. Given how effective your herbal antibiotic combos are for treating Lyme, why would a patient choose antibiotics that normally have higher side effects? It's a good question. So, herbally, I think that the herbal options, especially of the Atoba cat's claw and the liposomal cinnamon clove oregano, I think they work 85 to 90% of the time. Any prescription antibiotic combinations I put somebody on for the Borrelia Lyme germ also work with have that chance of success, okay? When it comes to Bartonella, however, I find prescription options work about 80 to 85% of the time, and the herbal options work about 70 to 75% of the time. So, for some people, they want to do the best chance, and so they're going to take the risk of what prescription antibiotics would do to the gut and the microbiome. They'll accept that risk for the increased 10% chance on Bartonella, okay? Now, also keep in mind, when I see somebody in my practice, I'm actually pitching ideas to them. I'll say, you could do these prescriptions or you could do these herbs. And then I just give them the chances they would work. And then I say, which one of these resonates better with you? Okay. So in my practice, I rely upon the intuitive sense that each of my patients has as well too, or I call it our knowers. Some patients know that herbs are going to work better for them. And if they do know that, I'm going to go along with that. There are also some patients in my practice that refuse to do herbs no matter what. And there are some patients in my practice that I can't get a prescription near them. Okay. So all of us are wired in different ways in terms of our preferences. And all of us are wired in different ways in terms of what we know might work for us. And I rely on some of our knowers to help me make decisions to help patients, or to help patients make their own decisions while I'm advising them. Okay. All right. Thanks for that question, Carrie. Hello, Cindy. Can I have Lyme parasites in my intestines without having Lyme? I carried for my dying husband. So I mentioned earlier, I don't buy the whole idea of the Lyme parasites. And I think, Cindy, I think you've asked this maybe a few webinars ago, and I just don't see that as an issue. Okay. All right. Thanks for that question. Hello, Carrie. Are mold binders safe to use during nursing a 1.5-year-old? Yeah, they're going to stay in the intestines. They're not getting absorbed into your bloodstream. They're not going to get to the 1.5-year-old. I see no problem with that. Okay. Hello, Leslie. Do you have any experience, information about DNA Connections Lab for Lyme and co-infections? I am newly diagnosed, and this is a lab my doctor used. Also, do you know LLMDs on the East Coast? I am in Southern VA, and I'm not very confident in the treatment I've received so far. Thank you so much for these webinars. I'm learning a lot. In terms of who's out on the East Coast in Virginia, I don't know off the top of my head. I would contact ILADS, ilads.org, go to their contact page, and then ask them who's in your area that's a member of that group, okay? Now, everyone's not equal in that group in terms of what they do, all right? In terms of DNA connections, many of us have problems with DNA connections. So first of all, DNA connections burst onto the scene maybe about 4 or 5 years ago with their urine test that looks to see, using a technique called PCR testing, to see if you have the DNA of each of these germs in your urine. Okay. Now, whenever a company develops a new way of testing for something that they don't have to sell to another company, they don't have to get FDA approval to do their lab. But what they should do is do testing to validate, to show that their test is valid. Right? And what that means is taking samples that are known to have an illness and ones that are known not to have the illness, and find how accurate are they at determining the true cases. Okay. They never did those studies. They never did them. In fact, I called them up to say, show them to me, and they couldn't present them to me. The reason I wound up approaching DNA Connections to ask them that is I had a number of patients coming to see me that had seen a lot of naturopathic doctors out here, and they were coming in with these DNA Connections tests, suggesting they might have Bartonella or suggesting they might have Babesia. But when I would query them about symptoms related to those illnesses, I found none. So that already had me questioning, is this valid? Okay. So I don't think that they're valid. I don't think that their testing corresponds with what I'm seeing in my patients. And they haven't done the basic steps that any lab should do to show that what they're doing is accurate. Okay. They, however, have done one thing right. They got a huge marketing organization. They did great convincing a lot of naturopaths and integrated medicine doctors to use their testing technique. And those doctors didn't do the next step that they should have done, which is to have DNA Connections send them their validation. So anyhow, that's my feeling on it. Okay. All right. Thanks for that question. Hello, Margaret. Let's see. Health Canada says there is no evidence that ticks transmit Bartonella to people they bite. What is your opinion about this? So I will tell you the data that says that Bartonella transmits or that ticks can transmit Bartonella is extremely limited. And it is based on, I think, laboratory experiments. It's not in true humans. There is a controversy here in the States. The Infectious Disease Society of America doctors also do not believe that Bartonella can be transmitted through tick bites too. Okay, it's just not Canadian. It's actually here in the States. There is limited laboratory evidence that suggests it can be. And so many of us go by that lab, not human experiments, to guide us because we find it helpful that way. Okay, all right. Thanks for that question. Hello, Darius. See, brain pressure is severe from Lyme infections post-COVID. So, Dari, I don't, oh, what can I do? Okay, there's your question. I would need to ask you a lot more questions. I don't have enough from what you've just written here, okay? One thing to consider, though, is when I see brain pressure that's severe, I tend to think of Bartonella being active. But to find out if Bartonella is active in you, I'd need to ask you a lot more questions, all right? So I can't answer it based on what I have here, okay? Good luck to you. Hello, Jean. If there are no other symptoms, would you consider that Bartonella is causing neuropsych symptoms? So Bartonella can cause neuropsych symptoms, but usually you're going to have some other manifestations of Bartonella too, like fatigue, like cognitive dysfunction, like maybe pain on the balls of the feet. Usually you're going to have something else. It isn't going to be just isolated psychiatric symptoms. Okay. All right. Thanks for the question, Dean. All right, everyone. That's it. That's it for me tonight. I just realized we're at 5:32 here, and I've got to get on my way to get home, get packed, and get ready for my trip tomorrow. Anyhow, it's been good to be here with you tonight. I will be working on editing up the video tonight and trying to get it ready to send out to you tomorrow morning. So keep an eye out. Probably around 8 to 8:30 in the morning, I should have everything emailed out to you saying that the video is ready to watch with my usual written summary about what we talked about. And also in that email tomorrow morning, you'll find a sign up for the July series of Conversations with Marty Ross MD. And so when you get that email, I'd appreciate if you'd share it with as many people as you think may get benefit from either hearing the webinar that we just did tonight or from signing up for the next series of webinars as well, too. I want to help as many people as possible, and you help me do that. So spread the word, okay? So I feel free to do that. And I wish all of you well this evening, and especially over the July 4th holidays. And so we'll pick up after July 4th, okay? Good night, everyone.